Hi, my name is Tasha Roberts, and my special issue presentation is on self-injury behaviors and the school counselor's role. This presentation is provided by the School Counseling Program at Mercy College. Self-injury behavior is a growing epidemic amongst young adolescents in middle and high school. School counselors are faced with the task of crisis intervention, teaching coping strategies, and developmentally preparing students who are plagued with habitual self-injury behaviors. This behavior is linked to so many other factors in diagnosis. But first, what is self-injury behavior? Self-injury behavior has many different shapes and forms. Self-harm and self-mutilation are other names for what is constituted as self-injury. There are many factors that play into why a student chooses to perform these activities. But first, we need an understanding of what is actually going on with the student. Self-injury behavior, clinically known as non-suicidal self-injury behavior, is identified as behavior in which a person commits an act with the purpose of physically harming his or herself with or without real intent of suicide. Deliberate self-harm is another name for non-suicidal self-injury behavior. Non-suicidal self-injury behavior can be displayed in various methods such as scratching, marking, picking skin, pulling hair, burning, cutting, headbanging, excessive body piercing, and tattooing. There are many reasons adolescents resort to non-suicidal self-injury behaviors, and many factors such as age, race, gender, and socioeconomic statuses contribute to the likelihood of such behavior. Non-suicidal self-injury behavior is done for many reasons, such as to reduce anxiety and tension, to reduce sadness and loneliness, to alleviate angry feelings, to punish oneself, to escape feelings of numbness, and used as a source of controlled pain. Adolescents that self-injure do not intend to die or commit suicide, contrary to popular belief. Instead, it is often used as a method of disassociation from the issues they are facing. It is imperative to understand the motivation to self-injure as well as what the student is trying to communicate through the acts. Adolescence as a whole is a very tumultuous time. There are a lot of changes, there are a lot of different factors that come into play when you become an adolescent. Adolescents often feel overwhelmed by the many decisions that they have to make, as well as the many new responsibilities that they have. Speaking and confiding in an adult may not be the first option for an adolescent, nor confiding in their friends. Adolescents tend to come up with their own methods of coping, which are often very destructive. Non-suicidal self-injury behavior has been associated with other diagnoses such as eating disorders, adjustment disorders, depression, substance abuse, and anxiety. Students who exhibit more negative emotions than positive ones and are less likely to express them to an adult are at a higher risk of resorting to destructive outlets for their inner turmoil. As non-suicidal self-injury behavior is viewed as a method of relief, it is often associated with a series of possible underlying issues. Other mental health disorders such as schizophrenia and personality disorders intensify the desire for students to self-injure. Borderline personality disorder is a diagnosis most frequently associated with non-suicidal self-injury behavior. Borderline personality disorder is classified as having ongoing varying moods, self-images, and behaviors resulting in impulsive actions and problematic relationships. School counselors and clinicians have been researching the causes and effects of non-suicidal self-injury behavior and have found data to be quite limited. However, statistics still show that only about 50% of adolescents who self-injure seek help. This gives counselors a very limited view on the true effects of self-injury and the number of students engaging in the behavior. According to a study conducted by psychologist Jennifer Muehlenkamp, PhD of the University of Wisconsin, about 17% of adolescents have engaged in non-suicidal self-injury behaviors at least once. Students who are bullied or rejected have difficulty expressing their emotions and have physical and mental disabilities are far more likely to self-injure. Students with intellectual disabilities are more likely to engage in self-injury. This can be from many different factors, but is specific in this population because of increased aggression and pressures in achieving academic success. Students may experience levels of hopelessness and low self-esteem. They may resort to a non-suicidal self-injury behavior that fits within their pain threshold and will still be able to go unnoticed and undetected. For these reasons, early intervention is the key to crisis management. Here are some warning signs of self-harm. Low mood, isolation, talking about death. Many students exhibit these signs and it goes unnoticed. Repeated and habitual non-suicidal self-injury behavior can lead to suicide. It is imperative that we see and recognize these signs in adolescence. Gender plays a role in the likelihood of an adolescent engaging in non-suicidal self-injury behavior. Girls have been proven to engage in non-suicidal self-injury behaviors more frequently than boys. However, this can be because of the apprehension of disclosure of the behavior. Recent studies have shown an increase in non-suicidal self-injury behaviors in males. Male and female adolescents with poor body images and emotional dysregulation exhibit greater levels of non-suicidal self-injury behaviors. Here are some statistics. About 15% of college students have harmed themselves at least once. Males represent between 35 to 40% of all people who self-harm. Young white females are the group most likely to self-harm. These statistics are alarmingly increasing, and it is necessary for us to get a handle on non-suicidal self-injury behaviors before it becomes even more detrimental to our youth. Socioeconomic levels have an effect on non-suicidal self-injury behaviors. Students of lower socioeconomic levels are more prone to self-injury behaviors. Lower socioeconomic levels are linked to lower educational and psychological success, which can precipitate the frustrations that lead to non-suicidal self-injury behaviors. The U.S. is at 26 to 37% prevalence in deliberate self-harm. Psychological health, education, family well-being, and parent involvement are all factors that are influenced by socioeconomic status. In turn, those same factors influence the prevalence of non-suicidal self-injury behavior. This picture shows the risk factors for self-harm in different socioeconomic statuses, genders, and single-parent households. Boys and girls in less affluent statuses showed higher percentages of self-harm occurrences than compared to their more affluent counterparts. Girls of more affluent socioeconomic status have reported 16% less non-suicidal self-injury behaviors. Boys of more affluent socioeconomic status have reported 8% less non-suicidal self-injury behaviors. A household of single parent is prone to 18% more occurrences of non-suicidal injury behavior than dual parent households. The presence of the school counselor can make the world of a difference. Students exhibiting destructive behaviors because of stressful changes and responsibilities confide in their therapist, clinician, and/or school counselor in hopes of finding relief for the pressure that they feel. When dealing with non-suicidal self-injury behavior, it is important to strengthen the relationship between the counselor and the student. These acts can be embarrassing and prompt students to hide and cover what they're truly feeling. The therapeutic relationship between the school counselor and the student can facilitate open communication, which can lead to effective treatment and help for the student. The introduction of different strategies for coping and crisis management will further push the student away from the ideas of non-suicidal self-injury behaviors. The professional school counselor's role is gravely essential in battling this issue amongst adolescents. Every student should be assessed and an action plan should be made for providing assistance for non-suicidal self-injury behaviors. It is important for school counselors to listen and understand what students are communicating when they resort to non-suicidal self-injury behaviors. School counselors should encourage and work with students who engage in non-suicidal self-injury behaviors to help them understand their feelings and emotions that would cause them to want to self-injure. They can learn new ways of coping that are healthy for their development. Non-suicidal self-injury behavior is a major problem, as it can be the physical manifestation of a deeper issue. All of the stakeholders should be aware of this rising phenomena amongst our adolescents. At each level, informative training and workshops can be given to effectively modify the comprehensive school counseling program and establish resources to raise awareness within the community. Schools should formulate a school-wide policy of basic guidelines on how to effectively handle occurrences of non-suicidal self-injury behaviors. This policy should be shared with other stakeholders, reviewed, modified in alignment with the ASCA mindsets and behaviors to ensure support for all groups and subgroups of students. Non-suicidal self-injury prevention includes knowledge about warning signs and risk factors, identifying high-risk students and connecting them to effective treatment, raising awareness in the community, establishing open communication about difficult issues, helping with social expansion, and removing the stigma around the behaviors. So, to wrap up, non-suicidal self-injury behavior is a deliberate act, but not to be confused with suicide, although it can lead to suicidal ideations. The behavior is normally exhibited by adolescents of middle and high school ages. Adolescents feel pressured by life's changes and problems and resort to this destructive behavior. It is normally viewed as a source of relief and controlled pain. Adolescents who engaged in non-suicidal self-injury behaviors often hide the scars of the act and are often withdrawn. Signs are often unseen and behavior can be ambiguous. Non-suicidal self-injury behavior is a very private act. A school counselor or another trusted adult can be someone the student confides in. The therapeutic relationship between the school counselor and the student can be the source of attention and encouragement that is necessary for change. It is important to know, be aware, and be proactive when handling cases of a student engaging in non-suicidal self-injury behavior. The community, the school district, the school counselor, the school staff and administration, and parents all play a part in the mental and physical safety and development of our students. Our students' success depends on our collective efforts to keep improving. That is my presentation on non-suicidal self-injury behavior, which is a problem that is increasingly growing within our communities. Our children are scared, they're overwhelmed, and they are lonely. We, as school counselors, have to bridge the gap between the outside world and school and the troubles that come with it. Thank you for listening to my presentation on non-suicidal self-injury behaviors, and I hope you enjoyed it as much as I enjoyed creating it. Together, collectively, we can make a difference and a change in our students. Keep up the great work, counselors. See you. Bye-bye.